external ear. So this basically this middle ear is comes under the middle ear cleft, which consists of this middle ear, include middle ear with ear station tube, with additives, with antrum, with mastoid air cells. This everything is combined is known as middle ear cleft. You can see this diagram. Middle ear cleft, it consists of middle ear. Behind or posterior it contains the mastoid, which is contains many mastoid air cells, including in the largest air cell antrum. The connecting portion is the adductus. The superior part of the middle ear is the attic, and the anterior most part is the ear station tube. So this is the anterior, goes to the posterior, guys. This middle ear is divided into three parts by the pars tensa, guys. You know the pars tensa, which is present in the tympanic membrane, which divides the middle ear into three parts. The part above the pars tensa is the epitympanum. The opposite to the pars tensa is the mesotympanum, and below the pars tensa is level of pars tensa is known as the hypotympanum, guys. Basically this middle ear is a six-sided box. Think that you are sitting in a room consists of four walls and above a roof and a floor. Okay, guys. So let's go into the each side. Okay, first the coming to the roof. The roof is made up of tegment tympani. Normally this this middle cleft is covered by the tegment. Here the roof is the tegment tympani. Okay, guys. Then let's go into the floor. The floor, we go into this diagram. See the floor, this is the floor, this is the superior or roof, this is the anterior, consider this anterior, this is the medial, this lateral part is got away, this is the lateral, this is the posterior part. Okay, guys. Okay, then the floor is made up of this jugular bulb and this carotid artery. Between these two jugular bulb and carotid artery there is a crust known as carotico-jugular crust, guys. Okay, then we next go into the anterior wall. The anterior wall gives opening for the eustachian tube, and it also gives the way for canal for tensor tympani muscle, which attaches to the malleus. Okay, guys, malleus. Then let's go into the posterior wall. This is the posterior wall. It contains a pyramid, which this is the pyramid which is giving rise to a muscle known as stapedius muscle, which attaches to a stapes. Then you can see this is the adductus. Okay, adductus. Opening for radius. This is opening for radius present in the posterior wall. Then there is this is the lateral vertical part of seventh nerve or facial nerve is going on the posterior wall. This is the lateral to the facial nerve is the recess known as facial recess. Then medial to this facial nerve is the sinus tympani, which we'll discuss afterwards, guys. These are the content present in the posterior wall. Then let's go into the best part or the important part is the medial wall. It contains a promontory, guys. See, promontory. You can see the promontory in this medial wall. Okay, guys. Then the promontory is due to the basal tone of the cochlea, which causes a bulge in the medial wall. Then we can see the oval window 3, oval window. We can see the round window 4. Okay, guys. Then we can see the process cochleaformis is important. There is the tensor tympani muscle which comes to this opening, goes and forms a hook this around this process cochleaformis and attaches to the malleus. This is a very important part. Then as the sinus tympani is also comes in the medial wall. These are the contents and walls of these are the walls covering the middle ear. Okay, guys. This is the lateral wall, which is the, as I said, this is the lateral wall. This part is taken away. Lateral wall, which is coming off tympanic membrane, and it contains the bone ossicles, tympanic membrane, and the scutum is it comes here. It is the tip of a bone above the tympanic membrane. It is Then let's go into the mastoid antrum. See, this is the mastoid antrum, which is the largest mastoid air cell, which is present at the birth. The cell size is same as at the birth, and as it goes bigger, as it age goes beyond. Okay guys, here the tegment covering is tegment antrae. So guys, here it's tegment antrae, here is tegment tympani. Aditus and antrum. This is the antrum and aditus. Aditus is opening to, which communicates to the antrum. Then looking to the mastoid air cells. These are very honeycomb appearance, very denser bones. There is three types of cells. It's well pneumatized or a cellular type. These are big larger cells, air spilled. This is known as pneumatized. Then diplomatic this is later. This is sclerotic or acellular, which contains no cells or no marrow, which is thick bone. Then diplomatic, which contains both the air cells and the marrow spaces, guys. Okay. These are structures present in the medial wall, which is promontory, process cochleaformis. This tympanic plexus is very important. Round window. Then you can see the oval window. This is not the oval window. Okay guys, you can see the pyramid of the posterior wall. Okay guys, before that we need to see an important clinical aspect. This is the McEwan's or suprameatal triangle. The post-oral approach is it gives the direction for the mastoid. If the infection is infected, we can approach this by this McEwan's suprameatal triangle, which is the superior body is formed in 4 temporal line, and the posterior superior segment is formed by this part is formed by the posterior superior segment of a bony external auditory canal, and that another wall is formed by the line drawn as tangent to external canal. Okay guys, then we see that present air cells present in temporal bones. There are both mastoid air cells and petrous apex air cells also present. The types like retrofacial air cell, perisinus air cell, periantral air cell, synodural angle air cells, squamosal air cells, mastoid antrum largest air cell, zygomatic air cell, peritubal air cell, then tip cell. Usually guys, this mastoid is a separate part of the temporal bone, which is formed due to the pulling of the sternocleidomastoid muscle. Think of it. Okay. Mastoid develops around the squamous and petrous spots. There is another important clinical aspect known as coronal septum, which forms between the squamous cell and petrous cell. If you are going to approach the antrum, if there is a presence of coronal septum, you can't reach the antrum. So locating the antrum, so this coronal septum, if it's present, you cannot reach the antrum. It's clinical aspect. As it is, there is presence of petrous affects and its air cells, guys. You can see this in the diagram. This is the petrous part of the temporal bone. It is pneumatized here. It is very dense, very light or gas present. You can see the normal anatomy. You can see the inner ear. You can see the ear ossicles, the cone. It appears as a cone. You can see the ossicles. Okay guys, then you can see the ossicles. There are three types. There is a malleus, incus, and the stapes. The malleus consists of head, neck, anterior process, lateral process, handle. This handle attaches to the tympanic membrane. Okay guys, lateral process attaches to tympanic membrane, and the incus has a body, short process, and a long process, guys. Which this malleus head and neck lies in the attic region. You remember the attic region. This is the attic region. Everything lies here. Then the stapes has a head, species head, neck, anterior posterior crura flute plate. This flute plate attaches to the medial wall, or okay guys, attaches to the oval window by annular ligament. Okay, then we are going to the these are the contents: ossicles and the intratympanic muscles. There are two muscles present there, tensor tympani as we seen in the above, and the stapedius muscle. Both muscles are present in the middle ear cavity. Then you see the tympanic plexus, which is present in the medial wall. It is formed by the two nerves: tympanic branch of glossopharynx, that is ninth nerve, and sympathetic fibers from the plexus around the internal carotid artery. Okay guys, they supply the main like tympanic membrane, tympanic cavity, mastoid air cell, bony tube, everything. It also carries secretomotor fibers from the parotid gland. This you see is seen in very important in the parotid gland, that is from the inferior cerebral nucleus in the brain, from the then goes to cranial nerve 9, or glossopharyngeal nerve, gives a tympanic branch which forms tympanic plexus, which then forms a lesser petrosal nerve, which then goes in attaches in the voting ganglion and the auriculotemporal nerve, and it finally supplies the secretomotor to the parotid gland. Another nerve is present in this, known as cauda tympani nerve. It is a branch of facial nerve which enters the middle ear through posterior canalicularis. It runs medial surface of the tympanic membrane, as is seen in the diagram earlier. See guys, this is the branch. This is the branch, cauda tympani branch. It's coming laterally and goes to the anterior root. Okay guys, it supplies it carries taste sensation to 2/3 of anterior tongue and secretomotor fibers to submaxillary and sublingual salivary glands. Okay guys, then you can see linings like acid is present in the throat, or nasopharynx is still there in the eustachians to blind by ciliated epithelium. In the cartilaginous part is supplied by the pseudocytific columnar, and it is in the bony part it is supplied by the columnar part, and the tympanic cavity is supplied by ciliated columnar epithelium. Everything is done by but the epitympanic mastoid is aligned by non-ciliated epithelium. Then guys, I lost the blood supply of middle ear. It is mainly supplied by the two main arteries, like maxillary artery and posterior auricular artery. This anterior tympanic branch of maxillary artery supplies the tympanic membrane, and the stylomastoid branch of posterior auricular artery supplies the middle ear and mastoid air cells. The minor four members is middle meningeal artery, the branch of middle meningeal artery, which is a superior tympanic branch, and the tympanic branch of ventral carotid artery. The lymphatic drainage, or the venous supply, is mainly by pterygoid venous plexus and superior petrosal sinus, which I explained in next video about the dural venous sinuses. Then the lymph nodes is drained by the main roads like pre-auricular and parotid nodes, infra-auricular nodes, post-auricular nodes, deep jugular, spinal artery nodes, retropharyngeal nodes. Yes, thank you for watching my video. Have a good day.